Hi, my name is Anna, and today I'm going to present a brief summary of my research paper. So, this is my research paper. It's titled Melanin, a UV ray protective molecule in foods that increase its production. And I'm going to give a brief summary of what it talks about. So, first off, what is melanin? Well, melanin is a pigment molecule, and there are three main types of melanin. There is eumelanin, which is in the brown to black spectrum, present in the skin, hair, eyes, and ears. There's pheomelanin, which is on the red to yellow spectrum, and it's present on the skin, hair, lips, vagina, nipples, and glands of the penis. And there's neuromelanin, which is in the substantia nigra pars compacta section of the brain, more specifically in the pigmented catecholaminergic neurons. And it's a pigment that accumulates with age. So you can see on the image there's a healthy control on the left side, which has a pigmented substantia nigra pars. We can see the little black shade there, and it's making a comparison with a Parkinson's patient, and we'll talk about that later. So, there are many factors that influence melanin production, like UV radiation, genetics, endocrine factors, paracrine factors, and nutrition. And the research paper covers all of them. But right now, I want to focus on how UV radiation influences its production because I want to explain how several factors and steps um, are involved. So, when sunlight hits the skin, well, let's remember there are five layers in the epidermis and there are keratinocytes in all the five layers, so these cells of the skin. These cells are particularly vulnerable to sunlight because when sunlight hits, it might hit the nucleus, and this might cause mutations that could lead to skin cancer. So when this happens, the body's negative feedback mechanism starts, and this stimulates the P53 transcription factor, which then increases the expression of a protein called POMC. Then, one of the protein's components, the alpha melanocyte stimulating hormone, travels to the melanocyte. So, the melanocytes are cells only found in the stratum basale layer of the epidermis. So, this hormone travels to that layer and then increases the expression of enzymes and other proteins necessary for melanin and melanosome synthesis. The principal amino acid involved in this process is the L-tyrosine amino acid, which is a precursor for both eumelanin and pheomelanin. So once the hormone and this chain of reaction happens, the melanocyte starts producing more melanosomes, which are the organelles that produce the melanin. A common misconception is that people with more melanocytes are the ones that have darker skin, but that is not true because we all have about the same number of melanocytes. What changes is the number of melanosomes. So these melanosomes are produced, and thanks to the cell's finger like shape, they can travel out of the cell and then be transferred into the keratinocytes. Once in the keratinocytes, the melanosome degranulates, spills its content out, and the melanin that was in them starts surrounding the nucleus of the keratinocytes, acting as a shield for the nucleus and for the genetic information. So, why is melanin important? There are many functions that melanin has, all covered in the research paper, but the main ones, first for eumelanin, as we said, the protection from UV radiation. Also, melanin, as it has a very high absorption capacity, it can absorb radiation that hits the eye and protect the eye from diseases like cataracts, macular degeneration, and retinal photopathy. It's also involved in the ear's response to acoustic stimulation, and it prevents noise-induced hearing loss and temporary threshold shift. And pheomelanin is involved in vitamin D synthesis, and it is present mostly in those with lighter skin tones and hair colors. And then neuromelanin plays a protective role by removing potential harmful substances like oxidized dopamine and toxic metals. Now, as we mentioned, um, neuromelanin plays an important role in Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that is caused by the death of substantia nigra neurons, those that are pigmented, which leads to dopamine depletion in the striatum, which is a part of the brain involved in motor control, reward processing, and cognitive functions. In healthy patients, the neuromelanin concentration reaches its highest point during the 60s, when patients are in their 60s, and then it starts decreasing as they get older. But in those with Parkinson's, they present a very low to non pigmentations from a very early age. Also, melanin derived from certain sources has also shown a high antioxidant capacity, anti-aging properties, and a positive outcome regarding the hypoglycemic effect. So, foods that increase melanin production. First, we have the L-tyrosine supplement. It's not exactly a food, but it has been shown that those with higher concentrations of this amino acid tend to produce more melanin. This amino acid is naturally produced by the body, but supplementing with it has this effect. However, it is recommended to first look for natural food sources that contain this pigment before looking to supplements. So, cuttlefish ink extract is one of the foods with the highest melanin concentration. It has a very high antioxidant capacity, and the pigment's ability to prevent oxidative stress both have a combined effect that helps maintain adequate antioxidant status and normal physiological conditions. Now, for Sepia manjonis ink, Sepia manjoni is a type of cuttlefish, and its ink also has a very high melanin concentration. Its antioxidant capacity can also reduce lipid peroxidation, where free radicals damage lipids, causing cell damage and accumulation of lipofuscin, which is a pigment associated with aging. This ink can accelerate the metabolism of cholesterol and fatty acids, thus reducing lipid peroxidation and preventing skin aging. And finally, uh, another of the foods that increase melanin production is Sporisorium rayleanum, which is a type of fungi that grows in trees, and it has an ability to inhibit A amylase and A glycosidase enzymes activity, which makes it particularly special because it can delay carbohydrate absorption and prolong their digestion time, thus lowering blood glucose absorption. These are the four main foods that increase melanin production. However, there are more mentioned on the research paper. If you would like to know more, you can read it. And that will be all. Thank you.